Ladies and gentlemen, if you'll let me have your attention, please, I'm going to read the emergency evacuation. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, please use the other stairwell. Do not use the elevators. Once you've reached the main floor, follow the exit signs to exit the building and quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles. We will call this meeting to order. Madam Clerk, have you taken the roll?
Yes, sir.
All present and accounted for?
Yes.
This is the April 30th meeting of the Human Resource and Insurance Committee. Item number 1 will be items on the agenda. If someone wishes to speak to an item on the agenda, if you will raise your hand, I will recognize you and bring you to the podium. As for the members sitting at the desk, it's set up to where if you push the button in front of you, if you will give me 1 second to recognize you, your microphone will be turned on. Do I have anyone wishing to speak to items on the agenda? Seeing no hands, we will go forward. Stand for a motion to approve the minutes of April 16th, 2013. Mr. Brown, do I have a second? I think it was Mr. Lewis. Any alterations or changes? All in favor, please signify by voting aye. Aye. Opposed, vote no. We'll now move to item number 3, discussion and feedback from employees to the committee regarding proposed changes of the health care plan. I think most of you have a handout in front of you, several of the feedbacks and things from there. Is there anything that we need to recognize from that? Seeing no lights, no statements, I'll move on to item number 4, discussion, possible action, proposed changes to the health care plan. Do I have anyone?
Got one, Mr. Chairman.
Okay, Mr. Dunlap.
Going over some of the employees, some of my employees, some of the feedback that has been sent to us tonight, I would like to rescind what was presented last 2 weeks ago and then start over on that if we could, please, sir.
Okay, in actuality, versus rescinding, we just had some recommendations. What we will actually stand for now, Mr. Dunlap, if you would like to make a motion of what to move forward with, then we'll go from there, sir, if that's okay with you.
That'll be fine with me.
If you would please talk as loud as you can, because we're going to have to write this down up here, okay. Mr. Dunlap.
Will do, Mr. Chairman. Looking and hearing from, again, my employees and some of the feedback that has happened throughout these last 2 weeks, make a motion we look at deductible, change it from 500 to 1,000, 500 and 1,000.
Okay, that the deductible?
Yes, sir. This
500 and 1,000. This
will be basically in tier. I don't know what tier it is, but employee $25, employee plus spouse $150.
Slow down just 1 minute, please. Okay, speed
employee
up.
With children $125, family coverage $175, $50 surcharge for spouse if they have insurance available somewhere else. If they are being paid from a company to not take their insurance, then that employee would be looking at a $250 surcharge. I don't know if that's an option out there that any company does, but we have heard that they are being paid. So if anybody here is being paid not to take the company's insurance, they should have to pay a little more, I think.
Okay, let me get a second, and then I think I'm going to recognize an expert on that, if that's all right with you. Do I have a second to his recommendation? I have a second, Sheriff Brown. Now, Mr. Mann, would you please do me one favor and step to the microphone? The item that Mr. Dunlap just brought up was if insurance was provided. Is that something? You ask the question, Mr. Dunlap, please.
Do you know of any companies in this area that are paying their employees not to take their insurance?
Absolutely. I
Okay.
coach them many times to do that, meaning if an employer says, you guys have heard me say this many times, how do I save money on my health care costs? Well, one of the first ways to do that is to have less people on your plan. And if you can incentivize them through any number of cash or other incentives to not take the insurance, then that's a savings to the employer. And so as a result of that, it's a cat and mouse game. One employer makes one move, another employer has to adjust to attempt to do something else. And so, incentives to not be on the health plan have been around a very, very long time. So you typically find that with larger companies. But that being said, I've got some groups that have 30 employees that recommend that, they'll use that strategy. You have to be careful that you don't run off only the young ones, because then you'll end up kind of getting out of whack of your premium. But I go too far into the insurance factory there.
In essence, I think your question is that fairly easy to police, Mr. Mann?
Well, let me be clear. There's a way to gather that data, and I believe that we would get pretty close to accurate. And let me give you an example. We're going to have a pretty good sense of which employers do what. You've got some major employers in your area that through different means we'd be able to know exactly what's going on there. But, if you've got Ray's welding shop, I'm not going to know, what they're doing. So it really comes down to, as you're having the employee fill out the paperwork, they have an opportunity to not tell the truth, for lack of a better. Now, what I have found in the past, many times that we've done this, whether it's spousal surcharge, spousal carve out, other types of mechanisms like this, by having the manager, even tobacco use, by having the manager sign off on that employee's enrollment form typically helps, because that manager usually knows kind of what's going on with that employee's family many times. Does that make sense?
Yes, sir. Does that answer your question, sir? Mr. Lael, you're recognized.
Thank you, Mr. Chairman. In this process of supplementing employees' salaries in lieu of insurance, what is the standard in terms of the amount of money that is being expended by these companies? Do you have any idea what that would be?
I don't have that data, and I don't know that anybody's ever actually attempted to gather that data. And I've got some national numbers, but the reality, guys, that national numbers don't matter. East Tennessee is what we're talking about here.
Exactly.
So it's not something that we've ever really been able to gather. And I can give you some anecdotal evidence, which it's typically between $100 and $200 a month to not enroll in that insurance. And if you think about that, if the average employer, that employee's insurance costs that employee between $5,000 to $7,000 a year, you can understand why they would pay $2,000 or $2,500 to incentivize that employee to not take the coverage. Now, healthcare reform is going to change some of that. There's some things around some of this, but you absolutely are having employers, as a result of healthcare reform, get more aggressive in trying to control their healthcare costs.
A follow-up to that question, should that become the practice, will that suffice to eliminate the federal requirement for provision of insurance?
That's a great question. The way the federal law works today is you've got to buy insurance beginning January 14. Okay, I'm going to simplify this. You've got to buy insurance from someone.
Like Monday.
You got to buy insurance from somebody. Okay, so I use my family as an example. If my wife can prove that she's on my insurance, then you know what? We've met the letter of the law there as far as having that insurance. Her employer can say, "Hey, she didn't sign up for our insurance. She's on her spouse's coverage." So at that point, there's not anything that we're aware of yet. And let me be very clear about this, guys. It is almost daily that these regs change. It is unbelievable the amount of uncertainty The meeting I was not able to attend last week, 2 weeks ago, was a healthcare reform seminar. The chief lobbyist for the Self-Insurance Association of America was there, which is why I wanted to be there. He stood up and said, exact words, I don't know what's going to happen, and if anybody tells you they do, they're not right. And this guy lives in D.C., it's what his job is. So today, there is nothing that prevents an employer from incentivizing an employee through cash or another incentive to opt out of their insurance.
Okay. The reasoning behind that is that since there was an amount recommended in this proposal by Mr. Dunlap of $250, I was trying to get a feeling of how that compared to what they might be.
I think it's right in there. And again, my numbers are, I've been doing this a long time. Sometimes I'm thinking 4 or 5 years ago when everybody's costs have gone up by 10% plus over those 4 or 5 years. Good news here at the county, we haven't experienced that, but most other employers have. And so that being said, you're going to see those incentives even begin to move higher over time.
Okay, my next question kind of builds on this. Should this plan become adopted and recommended, we've been doing a lot of discussion about savings and potential impact upon the health care fund so forth. And this may be a little early to ask this. Have you had an opportunity to look at what kind of impact these numbers will have on that in terms of a potential savings, in terms of increased revenue stream, and et cetera? Will this have a positive enough impact that it will make a difference in terms of trying to extend and keep healthy our self-insured funds?
Sure, that's a great question, and your membership of the committee has reached out to me many times over the last couple of weeks and said, hey, Drew, what about this and what about this? And so we have been able to spend a lot of times, and I had to apologize to somebody today. I sent them the wrong model, and because we had 75 of them run, and I clicked on the wrong link. So we have run these, and without, I joked with somebody on the phone today. I've shown you guys some of the sausage that we made, but most people just want to eat it. So I'm going to try to not get into all the sausage making. But the answer is yes, this plan, it does a couple of things. One, it begins to move you guys in the direction of what most employers have unfortunately had to do as a result of costs. It's not personal. It's a direct result that this stuff costs more and more. We've looked at a lot of different things over the last few weeks, and what I would tell you, it doesn't go as far as some options have gone, but yet it does some things where the thing that the 4-tier plan, which creates the environment where we're not having people enroll members on your health plan because if I'm already covering the kids, it doesn't cost me any more money. Betsy won't mind me talking about her. Betsy Cunningham was the best example of this. Betsy had the 2 girls. Charlie had a great job. She put Charlie on the insurance because she already had to cover the girls. It didn't cost more money. And that way she didn't have to manage 2 health plans. Does that make sense?
Exactly. I understand that.
So, and I know other employers, their plan's not as good. And I realize I'm talking about families here. I get that there's faces with names and on this, but it does that. Again, you get some additional revenue and contributions from your employees. I do believe trying to get the other employers to do their part is important. You have to acknowledge that your plan has become the health plan of choice. Now, what I always come back to people when they ask me is, Drew, does this go far enough? My question is, what's your objective? What most employers ask me is, Drew, get to a number. Okay? Where I know this committee may not be focused as much on a number, they may be more focused on just solidifying the health plan for the future, and it does that. It does.
Okay.
I hope I've answered your question.
Yeah, you've gone in that direction. What you've answered, if I may interpret, is that it will have a positive impact, and I'm sure this committee's goal across the board is to, we've worked pretty hard over the past years to manage and maintain this so that it does work for our employees. I've heard several people express that opinion here, and that's where, that's our goal immediately. I think there's none of us here would be silly enough to think that one solution is going to solve all the problems. It's not, because it's a very fluid environment that this is existing in terms of Obamacare and all the other stuff that's coming down, by the way, that's being written daily, as you said. Another question on this, and I'm kind of working through Bill's suggestion here. On the surcharge, the $50 surcharge, there's been information passed out and has come to me from employees and so forth that, number one, if there is a plan in the spouse's workplace that automatically makes them eligible for the surcharge. The second thing that has come to me is that if this plan is less than or not equal to what is being offered here, that will not impact them. And I think that is probably a point we need to get clarified, because there's a difference between offered and provided. There's a difference between, good and bad on this.
Let me address that. Those are great questions. And let me address this.
That's 3 great questions in a row, Drew.
Well, I was called an expert earlier, so obviously nothing said matters. Anyway, what I would tell you is, when I have put these types of programs, or other employers have done this, many people have been doing this for a long time. It is not the intent to, I'm going to use a hospital as a good example, because traditionally you've got especially where you have part-time employees, in an environment where it's tough hiring. I mean, you go try to hire a bunch of nurses right now, it's hard. I mean, that's a competitive hiring environment. A lot of the economy's soft. Hiring nurses is tough. So what hospitals will do to a part-time nurse is say, oh, by the way, you can be on our insurance if you want to. We're not going to pay any for it, and you're going to pay the full cost, which is $600 to $700 a month, sometimes more, which gets back to that $6,000 a year number I referenced. That's the real number of what it costs to be on a health plan. No one's talking about that, which is why we use the term full-time equivalent hours.
Right.
Beginning January of this year, every employer, if you're working 30 hours or more a week, you've got to provide benefits to that employee. So this is one sense where healthcare reform does strengthen a position, because we're able to define, okay, if they're working 30 or more hours, that now defines full-time, so that will follow the federal law. What I would also say, and be very careful, committee, is if you say to your members, well, this is only going to apply to you if their health plan is as good as yours, okay? Be very clear. Blue Cross's average deductible this year, average, is $1,300. You are going to find very few employers that have a deductible at $500 or less, including the state of Tennessee. So I wouldn't set yourself up for only if it's as good or better, then we're not going to hit you with this, because you virtually just said every employer.
And that's the reason for my questioning, is we go forward and define this and put it into actual final draft to go to the next level.
Yes, sir.
Some of those questions I think need to be well defined, because it's a safeguard for both our employees and for us too, because we don't want to get into that kind of thing.
Jody doesn't need to be making judgment calls, and so you guys, the committee votes on this, yay or nay, and you go to the next level and you say, okay, we need the wording, the actual, then we put that together and actually put the language together. And I will say this: no matter what language we put together is going to fit 100% of the scenarios.
No.
I can think of so many examples where an employee had a $5,000 deductible somewhere, and it was crappy insurance, and that wasn't what that employer was trying to do. That was not their intent at all. You had a difficult situation, got caught up there, and we fixed it. We looked at the situation and said, no, that's not what anybody was trying to do here. What my clients do is they say, look, all I want is the other employer to do their fair share, just like we are. And that's all we're asking here. And so again, we're going to see more and more of this as people become aggressive about cutting costs.
Yeah, you cannot argue that point you just made, that there is responsibility of other employers to step up to that point or whatever. However, in most cases with insurance and everything else, there's always those gray areas that people get tripped over. And unless you clearly define the parameters as you go forward with this, then you're going to do that, and that does a disservice both to the employer and the employees.
Absolutely. If they don't know the rules, how are they supposed to play?
And how can you play the game if you don't know the right rules to go by? And that's my concern when we have all of this stuff floating around, is that we need to define as closely as possible each step as we go, and it's extremely difficult. I know it's it'll spin you like a top, which is why we have you here, Drew, to keep us pointed in the right direction. I'm done. I'll hush.
You sure? Anyone else? I'm sorry, Mr. Merle.
Drew, thank you so much for being here to present to us tonight. And I just wanted you to, I've got a lot of school employees here today, and I appreciate all of them coming out this evening. A couple of things when I presented this to our staff, and a lot of our supervisors and principals also took it out to their schools from there, because we have a lot of employees, as you know. A couple of things that I was wanting to prepare them for increased premiums, because I think that's a reality. As we've talked through this year, that's a reality. I certainly didn't want to see it to be as extensive as the original proposal was, which could have cost people up into $4,000 range more than what they were paying now. So I was concerned, but I didn't want to say, okay, this is the groundwork, this is what's gone on in the past. So two things that I mentioned to teachers and classified staff was the Affordable Care Act. Okay, what are some of the things going to come along with that, which is, I know the surcharge, we're going to have to start paying for covered lives next year. Female reproductive services, contraceptives, some of the things that we know that are going to have to be covered, that's going to cost our insurance plan. So if you don't care to hit a few of those things, and also the last few years of high cost to our plan, a lot of high instances of illnesses that have cost a lot of money to the plan. I'm just saying 2 or 3 minutes.
I'll hit the highlights. Absolutely, the Affordable Care Act is going to cost every group that I work with more money, in really the ways you hit, I don't need to go much deeper. It's going to cost the county $5.50 per member per month. That's a significant fee that you guys just have to pay.
And that's for covered life. That's not per employee.
Per belly button. Yep. And that's done on a monthly basis that we then accrue at $63 annually. So if you've got 4,500 members, you can do the math. It's an extensive number that last year just didn't exist. So it's a new. That money is designed to go for beginning January 1. Anybody can go enroll in insurance with no health questions asked. Now, while that sounds great, there's a cost to that. Meaning, if I have a condition for whatever reason, I've been uninsured, Blue Cross they have to cover me without asking any health questions, and I can start dialysis treatment or whatever, and there's a cost associated with that. Whether that's right or wrong, I'm not debating. My world is just numbers. And so Blue Cross, these insurance companies have to collect money to pay for that. Now, you guys are self-insured, so the federal government said we don't want the self-insured clients to get out of paying for those, to help kind of prop up that individual market, which is what that's doing. So that's what that transitional reinsurance fee is to do, is to prop up the individual market. And I told an employer today, it wouldn't surprise me if that fee goes to $10 next year. Once that has begun, and if how the numbers go, how people smarter than me say they're going to go, we don't have enough money to pay for what we've enacted. So what's going to happen in the future, we don't know yet. Secondly, there are more services that are going to be paid for. There are no more caps, lifetime as well as annual caps, so someone can have unlimited medical treatment. Whether that's a good thing or a bad thing, I'm not debating that. It just costs a lot. You can have a burn victim run up to $3 and $4 million now, and I've got one right now at Emory, and been there along Emory University, Emory Medical Center. And, 2 or 3 years ago, treatment would have stopped at $1 million or $2 million. What would have happened at that point? There's a lot of different things that happen. Some people will question, do healthcare facilities continue services as long as they can get billed? You can get in this whole philosophical discussion. Point is, it costs health plans more money, okay? Not paying for prescription drug or the contraceptives, there's no more copay beginning January 1, for those things for my non-grandfathered plans, or grandfathered plans, meaning they're free. I don't like the word free. The health plan's going to pay them, the member's not. And so all of those things add up. There's also some essential benefits. Good news, you guys were pretty much doing all those anyway. You know, the other real driver, though, of your healthcare costs, as much as some of the healthcare reform stuff has frustrated me this year, the real driver to the Blount County costs are really the large claimants that we've had. To give you guys a sense of this, we've paid roughly in the last 2 years $1 million in reinsurance. I mean, we're going to be way over $1.8 million in claims paid out. I mean, we have had significant large claimants, and that's what drives our plan. As you guys know, I've told you this. We went 3 or 4 years. You know, we'd have a $200,000 claimant and maybe another 180, but generally speaking, we were doing pretty good. You know, we've got claims this year north of 575. We've got another one north of 400, another one at 320. I mean, those are the things that drive the health plan costs. Okay, and so as much as there's actually a real impact to Obamacare, healthcare reform, our large claims, you guys, your 4,500 members are really what's moving the needle this year. Okay. I hope I addressed your question.
Yes, you did. Thank you, Drew.
Who hit the button? You're recognized.
I know this is a projection on your part, Drew, but what you know so far about the Obamacare, what you're seeing with our claims now, what type of an increase do you think we should be looking for over the next 2, 3, 4 years? Any idea?
Well, I'm gonna start with one thing, and then I'll back off a little bit from that. But I want to give you a sense of what's going on out there. So I met with the executives from Blue Cross Blue Shield recently, as well as United Healthcare. They're fully insured customers, okay, not self-insured. I want to be very clear about that. Okay. They're expecting upwards of a 20% rate increase this January. Okay, and that's real. That's happening. You guys, medical trend in our area is in the roughly 8% range. You guys have outperformed that beautifully for the past 5 years. I mean, just awesome. This year, not so much. Okay, so the 8.5% range is really where I have been, you know, projecting you guys for the next, from July through June of 14, okay? Now, beyond that, what we're seeing is we're still expecting trend to be in that 8 to 10% range. I don't think your reinsurance is going up this year. I don't want to not say that. But reinsurance, we may buy a higher deductible. We never want to pay too much premium, you know. Once you pay premium, you never get it back. I'd rather take a little bit more risk, lower that. So some of that's going to go up some. Humana's going to want a little bit more because they have to do a lot more now with healthcare reform. I mean, they have got a lot on their plate now. The big unknown is when we bring these 35 million people into the system who currently don't have insurance today, what's that going to do? And that's what we frankly don't know yet. And I'm not even going to speculate because I don't know. I mean, I talked to my physician friend yesterday. He was all excited. He said, well, maybe more people have insurance, more people can come see me. And my comment to him was, well, but your reimbursement's going to go way down. So you may have more volume, absolutely. But, you know, if you're making less, what's your end goal? What are you really trying to do? Do you want to work 100 hours a week? You know, I don't, you know, I was joking with him. He's like, he feels like he does now. I'm like, I'm pretty sure you don't. But I don't know, Bill. I mean, we're going to find out. But right now, I would tell you that 8 to 10% range is where the county ought to be putting that away. And then, and y'all have done that. You know, you've done that, which is how the health fund got to healthy balance. And this year, we've obviously spent through some of that because of the difficult year.
True, very true. And a lot were excited, you know, when they first heard the thoughts of, oh, everybody's going to be covered with insurance at no cost. Now the excitement is leaving, knowing it's going to cost somebody something.
Well, I got to be careful. Yeah.
One more, I'm with you. One more question. We've talked about in the past multiple plans, you know, the tiers and the multiple plans. If we went beyond right here, right now, tonight, would that cost the county more for you all to implement, training to implement the whole 9 yards?
Yeah, Bill, it's a good question. It's not. Look, most employers have multiple plan options of your size. because they acknowledge that not every family's the same. Okay, I'm in a different spot maybe than you're in, and I've got young kids and I'm more worried about pediatric visits. Maybe you're thinking about maybe other things, and so people are in different spots. So it doesn't, and so I say that to say that's sort of the norm, and that's sort of what we're used to and what the Humanas of the world are used to. The first year that you implement that, it's absolutely work on HR, and if we get to stay around, it'd be work on Trinity. But I mean that it's going to create work for Jody, sure, absolutely, and Don. But from a Humana thing, maybe they charge us an extra $1. It's not going to be a bunch. That I don't. So I would never do that because of the fixed cost portion. It really becomes down to a philosophical decision. Do we want to have one plan for everybody, or do we want to have multiple options? And I have employers that think both ways. But to answer your question specifically, it's not going to cost more, other than just making sure we had the contributions set properly, so one plan wasn't priced better than another plan and everybody ran to one plan. But that's, you just have to, the first year you roll it out, you don't know. I mean, you guys had me doing these projections. They said, Drew, how many people are going to sign up for this plan versus this plan? Well, I got a pretty good idea, but until we get there, I truly don't know.
Ladies and gentlemen, I see no lights. If you have no additional questions, we have a recommendation of what to forward to the full commission. Now I see lights everywhere.
Sorry, Chairman. One of Holden's great questions addressed the $50 surcharge. How would you phrase that on the $50 surcharge that he mentioned a minute ago?
Okay, let me make sure I understand your question, Sheriff. How would I phrase the?
Well, you said viable insurance or equal or equivalent insurance, and
yeah, we would actually probably go so far. Okay, a couple of things, and I'm a little of this is changing because of healthcare reform, to be very honest. This year, Obamacare healthcare reform says that you can't have a plan with a greater than $2,000 deductible. Well, I have many, many clients with greater than $2,000 deductibles. So one of the things that we would probably do is use that $2,000 deductible as the threshold. What I would say is we would put a cost on a monthly or weekly basis. Well, do it monthly just so we could say, we would say if the plan costs more than X and the deductible is more than Y, then this either does or doesn't apply to you. And so you do put some teeth around it, because I know what the committee's trying to do. You're not trying to make a family spend an extra $4,000 a year or have a health plan. But what's happened now is the health plans all sort of have to live by the same standard. One of the benefits to healthcare reform was the insurance companies all have to kind of meet a certain threshold. And part of that threshold is that $2,000 deductible. And I will tell you, a $2,000 deductible is pretty commonplace. I mean, my deductible is north of $2,000. And I've got folks that are like you guys that are, you know, in that under $25,000 category. So that's just what folks have had to do. So what I would recommend is having an actual, this is what it looks like if your plan is X or Y. Because, like Holden said, I mean, if the folks don't know what the rules are, they can't play by it. And we're going to have to see. Right now, there's some dysfunction between the insurance carriers and the Department of Labor and Health and Human Services. Is it large group that can have north of a 2,000 or only small group? And this is some of the stuff that's got to play out. But and you guys would have every right to decide where those thresholds are set. I would just be an advisor in that role. Hope I answered your question. Not so much.
Mr. Lale.
Yes, thank you. Going back to some other comments that were made earlier, Mr. Merle represents quite a few people from the Education Department. There's some issues there that would have to be addressed in this process too. Number one, as I understand it, their benefit package is a negotiated or a collaborative decision process, whatever the current nomenclature is. That's one thing, and maybe Mr. Merle can shed some light on this. Secondly, there's funding from the state that occurs to the basic education program. Right. That has certain requirements on it that you cannot offer, quote, an inferior product, because they will not
Absolutely.
And that will end up costing as much as $4 million, I think, if that's correct, Mr. Merle. And so there's an impact as we go forward in this decision-making about those type things. And I guess I'm doing this not as a question, but as a bit of information that I think we need to consider as we go, because we can get ourselves boxed into a corner pretty doggone quick there on those aspects, and particularly when we have different categories of employees. One being, the education department, teachers, and their requirements by the state, and their funding and their formulas there. The second being that we have the rest of the county employees that are not covered under these kinds of guarantees, and they're pretty much whatever we decide or goes forward from here. So do you see how that can be reconciled so we can get a better idea of the cost at the end of the day?
Absolutely.
Okay.
I will say I'm not going to sit here and say 100%, but boy, I'm very confident that this will meet the actuarially equivalency that the state requires. We looked at the state's plan to make sure that what we were doing, and we went through this process a couple of years ago with you guys as well. And since then, the state's plan has changed dramatically. Okay, their deductibles are now $700 and higher. Their drug card is now and has I want to think their top copay is now maybe $90. I'm remembering off the top of my head, maybe $80. But I am confident that this plan would continue to achieve what you're doing as far as that state equivalency, so you would be eligible for that funding on the teachers. And one of the things that's always surprised me about that, when we went through this deal last year, we sent the info to the state, and they sent it to their consultant, Mercer, out of Atlanta, who I know very well. And Mercer comes back and says it's 99.7% equivalent. I'm like, where did you come up with that? But the frustrating thing was they didn't even look at the contributions. They only looked at the plan design. And my point to Mercer was the single plan's free and family costs $100, and the state plan is $350 for family? How can that not? You didn't weight any of that. Do you follow me? So, I mean, but I know they've had to change their plan over the last 2 or 3 years, because you can imagine what a burden to the state. That's a giant. I can't remember how many. I think it may be 100,000 people on that state plan. It's a huge sum of money. So I do feel very confident about that. But I mean, we will absolutely make sure that happens before you guys. We would never let you get so far down the road that it would cost you to risk that state funding.
I'm going to repeat this again. We have a motion before us. We have a second. If you would like, I will have Ms. King repeat the motion. Understand, this will be forwarded to the full commission for the full commission's approval. I do understand Mr. Merle's position. Once this goes through here, it will go back to the school board, and I'm sure they will check to make sure it meets the requirements, because no one wants to see the school system lose $4 million that is currently being furnished. And on the advisement of Mr. Mann, we have gone through this in the past. This isn't something new.
One thing.
Okay, well, time out. I've got lights lighting everywhere again. Mr. Merle.
I do have a question about the motion. The retirees will be covered under the same, as they are now, they would move to this new
Yes,
premium
sir.
schedule? Okay, so it wouldn't state what it is currently for retirees, they'll just move, okay. I just want to make sure that's clarified.
If it... No, sir.
We are, okay,
They were not specified.
okay.
I just want to make one thing.
Time out. Let Drew answer the question.
Okay.
I just want to be real careful about one thing that is specific to your teachers. The reason why this has not, they won't let me send them 15 plans to evaluate. the Mercer, the state. So that's why once this body does make a decision, then step two, I wanted you to understand the process there. That was the only thing. Because I can't just keep sending them, well, hey, they're thinking about this. How does this look? They're thinking about this. They tell me to pound sand at that point. So.
That's what we need to find out.
Let me back up to Mr. Merle's question. The question was retirees. If we do not specify different, my understanding is they will be handled the same as everyone else. Is that part of the...
I assumed the answer to that was yes. I just wanted to make sure of that. That was a question I wanted to make sure was answered
That would
here.
be my understanding of it.
They just follow the new premium schedule.
If we don't specify anything different,
Okay.
Mr. Merle, in it, then that would be yes.
Okay.
Mr. Brown?
I really don't know who to ask this to, but I just want for a point of clarification. As you all know, we fought this down for a number of years. We knew the increases were going to come, and it's something that's not popular and that we don't feel good about doing, but unfortunately, we want to provide insurance to all of our employees. With that, Randy, I guess I'll ask you, these changes that we're making here will generate some money, and in your opinion, will it fix us for a couple of years or at least?
Actually,
And
why don't both of you with ties on stand up and come to the podium, please? I enjoy sitting here.
Buy lottery tickets if you get this right. I wouldn't dare predict the impact of anything on Washington on us.
okay,
I'm not trying to avoid the question, but I wouldn't bet a nickel on that.
okay. But it's
I'll answer it this way, and it'd be
don't sit down, Randy.
Yeah, this will be a strong statement, but I mean the math plays out. Doing nothing this year and keeping your funding levels the same. I mean, you won't meet auditor standards at some point for the reserves you'll need to have in the health plan.
Now, you said keeping our funding levels the same. That means keeping the county contribution the same, right?
Well,
that's where I'm going with this.
Okay, I'm not going there. What I meant was through, that's not where I was going. I'm sorry, Sheriff. What I mean is by making some changes to shore up the health plan, meaning deductibles, 4-tier rates, some things to try to get some other employers to do some things to try to make your plan the less plan of choice. Because what we think is going to happen is small employers are really going to consider dropping health insurance. It's absolutely, my clients are absolutely considering it. Well, that's going to bring more people onto your health plan, okay? And so what's that going to do? And so I'm not necessarily talking in terms, Randy can address maybe more the thing, but what we've done is said, look, if you make these changes, this will generate this amount of money, and then you want to divide up how the cost is. Does that make sense?
And we've talked a little bit, but just for point of clarification before I cast my vote in a few minutes, the county funding levels or contribution for each employee, they tend to stay the same? Or the 425, I think the county is giving 425 per belly button, as you said earlier, to the active employees. Will that contribution stay the same or intend to stay the same?
Under what I've heard, yes.
Okay, thank you. That's what I need to know.
Sheriff, that will actually be item number 5. That'll be the next thing we deal with. That's okay. That's okay. Mayor?
I'm backtracking a little bit here, but it was the question that Mr. Merle had on retirees, and the answer I got, this will apply to retirees, correct? Is that what I'm hearing? What about people that are already retired? Are they going to be able to maintain where when they retired with a particular plan that probably they based their whole retirement around. I mean, are we going to come back now and ask them to start paying when that was?
That's up to this body.
Is that?
I mean, if we don't have an amendment specifying different, if we put one thing forward, you know, it's sort of up to this body, Mayor.
Well, I'm just thinking, you know, those people retired with in faith that they were going to have that retirement insurance.
Okay. Would you like to make an amendment to leave the retirees the same, Mayor?
New retirees, yes. If people that are already retired, I don't think I'll make an amendment that we don't change their insurance.
Amend it to leave existing retirees as is.
As is, yes.
Okay, we have an amendment in a second, but let me back up to the initial motion makers and the second, and if they have no problem with it, we will add it in. Initial motion maker was Mr. Dunlap. Okay, sir.
Can we have discussion now?
Yes, sir. We can have discussion.
And I respect what you're saying, Mayor, but I sympathize also to the active employees. When I hired the men and women that work for me, I told them what their health benefits were. And here we are, you know, 6 months after I hired them or 20 years after I hired them, and we're changing those today. I think, you know, if we got a problem, we got a problem. Again, I don't want to put any hardship on any certain group whatsoever. And I respect the people that have worked here and retired here. And I respect that they're on retirement pay versus full-time pay. But I don't know how you could distinguish or separate the two out. If you got one plan, at one point in time in the late 90s, we were paying $198 for dependent coverage, and we reduced it to $100. Those retirees and the other employees of the county went down to the 100. Well, we reduced them down. They followed our downturn, and I just don't know how you could separate the two.
You're still lit.
Well, I support this plan 100%, and I support the day that this goes into effect, from that point forward, that the retirees would be paying this. I just know that you know, some of these people, when they left here, when they retired from here, were under the understanding, and they based their whole economic situation around the fact that this insurance was going to be nothing for them, but they would pay for their spouse or their family if they still had a family. I know that you know, I understand we're talking about the difference between the employees and a retiree, but you know, you're looking at probably retirees making 40% of what his you know, 30 or 40% of what his salary was when he worked here. So I mean, he or she has taken a pretty good hit on being retired. And they are paying. They're paying 0 and 100. I mean, for the family, I understand that. I don't know. It's just, to me, you know, I think that was one of the things that everybody works for, because you know, they don't work for the money, because not many of them get paid enough for that to be a motivation. But they do work for these benefits, and I think one of the benefits that we've always had was when you retired, the county would give you your benefit package, and it would be this number. And I think that that's what they strive to do. That was, you know, when they saw that out there ahead of them for their retirement, that's what they had planned on paying, and probably based their whole economic situation around that. I just think that it's to come back now and say, you know, we're going to charge you something that we're going to increase your charges. To me, it's kind of like you're, you know, they've paid their dues and they've retired, and now you're coming back after them again. I don't know. I just think that if they retired under the understanding that this was going to be their insurance, right now it seems like it's going to be difficult in these times to come after them and start charging them more.
Mr. French.
Thank you, Mr. Chairman. two questions, and one for Mr. Mann, and one for anyone that can answer it.
All right, this is on the amendment, I hope?
Yes.
Okay.
How many employees are we talking about? Does anyone know? The retirees is what I'm talking about.
Roughly 100.
100.
It's not that much.
And
256. I'm sorry.
pardon me.
256.
256. It's in the handout that you
Okay. got. And the next question, Drew, do you run into this situation at other other plans? I'm just curious, and what's your take on this?
Yeah, yes, and I would say that most employers, when they make a change, it's for everybody on their health plan, right or wrong. And I understand where the mayor's coming from completely, because you do want to be able to count on something and, hey, this is what we agreed to. But what happens is I guess the thing I would tell y'all, most employers are having to make changes every year. And so since they're making changes every year, it's mechanically too difficult for them to have a bunch of different, well, they are there and here, and so it's across the board changes most of the time. It's less complicated because at 65 you do mandate that they go into Medicare, and so that solves some of y'all's issue. You don't have retirees on your plan for, north of that. But to answer your question, most employers just kind of do something across the board.
Mr. Lewis?
And I guess the other issue, in fairness to everyone, is that this problem affects everybody. And so in order to fix it, in order to be able to provide the benefit down the road, the solution really needs to be for everyone. And so retirees, in order to have this benefit continue, probably need to help solve the problem. So as painful as it is to have to do it in the first place, to leave a segment out so that everybody doesn't share in the solution probably isn't the right thing to do. So it's just a problem we all need to try to solve together, and I think that includes that group.
Let me intercede one thing. Payment by employees is not the only thing included in this motion. There is also an issue of deductible. So understand that would fall into, if we leave theirs the same, that would be involved also. Mr. Lael.
Oh, thank you.
Please, on the amendment.
On the amendment. First of all, echo what Mr. Mann said about the age 65 is a sunset, so that's going to be a decreasing number of, whatever the number is now. That should be theoretically decreasing each year until it becomes no longer a factor. If we start this year and the next level or the next number of retirees, come under the new plan rather than the old plan. Secondly, part of those people retired under a contract agreement again, that we may have some issue. And if you'll recall, a few years ago, they had the same issue at the at a company over here, where they had retired under a contract under certain things, and they cut those, and that ended up costing a huge lawsuit. So that's a possibility. I'm just giving you some thoughts for information as you think through this. I seconded the mayor's amendment because, as I said, these two reasons. Number one, that is a sunsetting number that we're dealing with, and should these new requirements be taken forward so that if you retire in the next year or two, then you will be under the new ones, then we're going to have a balancing act that's going to gradually get a little bit better. Softens the impact on those people who have already decided, I'm retiring and I planned on doing it this way. Again, just thoughts that you might want to mull over as we think through this on the vote. Thank you.
Sheriff Brown.
If we separate it and we choose for it not to
Excuse me, whoa.
If we go with the mayor's motion, are we administering you got to administer two plans? Will it cost us more to do that?
I'll go back to my earlier statement that was asked, would Humana charge us more to have two plans? I mean, it's on your $18.5, $19 million health plan, that's not a lot of money. So
Yes or no?
Yes, you would have two plans.
Would it cost us more to have two plans? Yes or no?
Yes.
Thank you.
And this, I'm not sure who, Jody or maybe Ginger could probably answer this. Who is the youngest retiree we have on our insurance right now? Is it 52? Is it, I don't know how quickly you could figure that out, but. Because I know teachers start at most of the time 22 years of age when they get out of college, so 30 years they put in. So I'm saying, are we going to have to deal with this for 13 more years? They're on the other plan till they're 65. This may take 13 years for this to work itself out till we're back on one plan. I'm not saying I disagree with the mayor. I don't know for sure what I'm going to vote yet, but I just wanted to throw that out. So I don't know. I would say 52 would be so if we do decide as a group, then we're holding this issue for 13 years. So just a thought.
I have one question. I want to know, how long will it take, the concerns that Mr. Lale brought up about the legalities and so forth with that group, how can we find those answers? Mr. Merle, how long could...
His concerns with the teacher contract, we would just have to address that with our attorney. So I could talk to Mr. Lale and see, we get the specific questions he had. So, I mean, it wouldn't take long. I mean, we can look at our contract and get a legal opinion on it. So.
And we could have that before a commission meeting?
Oh, yeah, we get it. Oh, yeah.
Okay.
A lot quicker than that.
Okay,
Yeah.
thank you.
Yeah. You're right there.
Mr. Chairman, and I will step forward and make the motion that the rates remain the same at $425, and what was the other for $550?
Yes, sir. I spoke with Mr. Heineman from Blount Memorial Hospital previous to last week's meeting, and I understand y'all ran long and were unable to get to this issue. Had a great discussion with him. Two things I'll talk about, the contract as well as service. So I'll talk about the service piece first. They acknowledged that the transition to ETMG, new systems that weren't talking to each other, understaffing, were not good. They also acknowledged that the flu that hit Blount County, it put them behind. And I think even some of your committee's members experienced some unbelievable waits. And I referenced those to him. And I think some of them caught him off guard. And I just told him, I said, then you've got your people not telling you the full story, because you've got pretty well recognized faces in Blount County that were sitting in your clinic for 3+ hours, whether they were in and out and moving different waiting rooms, but it told me now that their average length of time, he looks at this every 2 weeks, is under 45 minutes currently. They'd like to see that under 30 minutes, and are staffing that accordingly. But his response was kind of a combination of a couple of difficult things, including a pretty bad flu outbreak that I think some of us were aware of. Secondly, as far as the contract is concerned, spoke with him 2 weeks ago. It was 2 weeks ago last Friday, and told him that we needed those new rates, and he was meeting with the ETMG executive team and told me that he would have those new rates in my hand within 30 days of that conversation, which gets you guys enough information. So then I, of course, asked, well, what are you thinking? Tell me what your sense is. And Mr. Heineman's comments were, I don't think we're necessarily making a lot of money on this, but we want it to be a good thing for Blount County. We want it to be a good thing for the physicians, the practice at ETMG, and we feel like that's really our goal, is not to have a giant profit center for him. It really is. He feels like it's probably a wash for them. And I will say this, based on, he made a comment, the meeting I was not at, where Don shared some of the pricing from some of the other RFPs we've got. Mr. Heineman referenced it. First of all, he obviously is undercharging because he saw a couple of those other bids. And I will tell you, these are good companies that we do business with. I mean, really solid companies that put clinics together, and it's going to be 2 times. I mean, I can't skinny it down and get it less than double what you're paying today to try to replicate it, because they already have that infrastructure. He did reference that in the future he would like to explore something very interesting. His clinic costs him a lot of money for his employees too. I mean, he's got a bunch of employees over there, and talking about doing some things with the county in terms of a joint facility. So those would be some things that he would be interested in exploring, and I think there's some benefit to that. I expect to have those rates in my hands in a couple of weeks. I don't feel like they're going to be asking for a large amount. What I will come back and tell you is there's a number he could get to where I would tell you guys, you may want to do it for certain reasons, but from a math standpoint, it may not work. What I know today is the claims that you're having, had those claims gone somewhere else in a retail environment versus what you're paying them, it's about a wash. And that was really had always been the goal, was look, we're going to pay that money, we'll have this good benefit for our employees, ETMG charges us a fair rate. But there will be a point where I'll have to come back to you and say, hey, this is costing a pretty significant amount of money. Now, that being said, every other employer I have that has a clinic, it's an investment. I mean, it costs big time, some of them. But what they do is they hope that that avoids some large claims and things. So being long-winded here, but I should have those rates in 2 weeks.
If you would be so kind, sir, would you please notify Mr. Stallions and Miss King, and if it's all right with this body, when we receive notification, we'll try to set up a meeting to deal with this, because we do need to deal with it before June 30th if the rates increase.
Yes, sir. My sense is they will send those rates directly to Don and Jody. So they'll I'm sure Don will pick up the phone and call me when he gets them.
Thank you very much. Is that okay with this body? I don't see any heads shaking negative, so we'll go on. Items not on the agenda. Anyone wish to speak to items not on the agenda? Judge Brewer, you are recognized. Please come to the podium, please, sir.
Thank you, Mr. Chairman, and members of the committee, for hearing me just a moment. I'm here in my capacity as the chairman of the Emergency Communications District here in Blount County, the chairman of the board of directors of the 911 board. The district is a government entity that was created by two statutes. Back in the mid-'80s, statute was enacted by the legislature that authorized a political subdivision, and in this case the county, decided to hold a referendum to determine whether or not to create a district. And that referendum passed. Any politician would like to have a 91 to 9 pass rate on an election. The citizens passed it by that large margin. Then at that time, in existence was what was called the Communications Committee. It consisted of the representative, or the county executive at that time it's called, and the city managers of Alcoa and Maryville, and they dealt with the dispatching for the county. In 1999, those functions were merged by an intergovernmental local, I want to make sure I say it right, cooperative agreement in 1999, and it created the district as we know it now. That agreement called for certain matters to occur, certain things to occur. Most importantly was the funding of the district. The funding of the district, as you know, is some of it's by the phone, the revenues from the phone, but a lot of it is from contributions from Blount County, Maryville, and Alcoa that everyone is asked to vote on, and you've done it for years. It's similar to what I call it a hybrid, because we're funded by three different entities, government entities, similar to the Park and Recreation, similar to the library, funded by all the governments. And I'm here prefacing all this by stating to you that our district, at this point in time, we pay for our own insurance. The Park and Rec has hooked on, and they are on the City of Alcoa plan. The library is on the Blount County plan. We, based on what's going on in the industry, as the expert has told us, we desperately need to hook on and be a part of a government's plan. For the past, our insurance has gone up 20% or better for the past 2 years. In fact, 2 years ago, we began requiring our employees, if they wanted insurance, to contribute considerably more than what this body just passed. We would propose to join the county's plan. Now, should you do it or can you do it? The can you do it part, I've looked at it, and of course I'm not y'all's attorney or anything, but I've looked at it and I see no reason why we can't. I've mentioned this at the suggestion of one of your members to Attorney Garrett. He's looked at it preliminarily, and I talked with him last week about it and explained the situation. Then I talked with him again earlier today, and he said, except for he needs to look at one or two more things, but he sees no reason why we couldn't. What we would propose in theory, and we could work out the nuts and bolts, that from our budget, we would contribute per employee, just like what the amounts that y'all just set, the $425 and the $525, whatever the employee wants from our operations. And then we would contribute that from our budget, and then certainly pay, you know, the same amount. The employee would pay the same amount of what y'all just said. I mean, as far as the intricacies and all that, you know, we can work all that out. I hope, but in theory, we've got to do something, or what we're looking at now is going to be just outrageous for our employees as far as insurance. I mean, in order to keep the district itself, to keep us from having to come back here and say, hey, we need a bunch more money to fund our plan, we're going to have to put it on the employees, and it's going to be some of the numbers he's been talking about. So it's outrageous. We'd ask that y'all consider that.
Bear with me 1 second, Judge. Mr. Dunlap.
How many employees are we talking about, Your Honor?
26. We have 27 employees, and only 26 opt in to take the insurance. I think one's young enough to where he's on his mom and daddy's plan.
All full-time equivalent?
All full-time.
Okay.
Right, yeah, come on up here. I may need your help here.
Okay, I was sort of waiting for someone else to light a light, but let me come forward to you with this, Judge. It's obvious we're going to have another meeting of this body.
Okay.
How soon do you need this information? Is this something we need to suspend the rules and deal with tonight, or is this something that we can deal with when Mr. Mann gets us the information on Blount Memorial?
I'm here because our plan year begins, and I don't know why it does, begins June 1. So we're under a gun. That's why I wanted to get on your agenda tonight. Tried to get on the regular agenda, and apparently it was too late, and that's why I'm here on this. But if you know, I would, whatever you can do to help us. And you're subject to, you know, again, if Mr. Garrett comes back and says that we can't do it, then we'll know what we need to do. But we need some help, or I'm going to be coming back here asking for a budget resolution to help keep us afloat.
Okay, ladies and gentlemen, I can do this one of two ways. If there is no objection, we can deal with this tonight. Obviously, anything here has to be forwarded on to the full commission. So if it is without objection, I will add Judge Brewer's request onto the agenda, and we will deal with it. If there is objection, then I will stand for a motion to suspend the rules to add it. If you would, if you have your lights on, if you'll, I'm sorry.
I don't have an objection.
Okay. If you would you mind dimming your light, Mr. French, till I finish? If you have an objection, please hit your light. Okay, sir.
I don't have an objection. Although,
okay, that I just said if you have an objection
I would like to hear the attorney's opinion regarding this before we vote on it.
Oh,
and if we can have that before...
But what I'm getting at, Mr. French, we can't discuss it until we add it. If there is an objection, I will not add it. I will stand for a motion to suspend the rules. If there is no objection, then I will add it, and then we will go from there. I see no lights, so I see no objections offered. That being the case, Judge Brewer, I will add you to the agenda a request to consider the 911 board employees.
Well, I'd say properly phrased would be the district employees.
If you will properly phrase it for me, I'd appreciate it.
If you would consider adding the Blount County Emergency Communications District employees to the Blount County Healthcare Plan. I mean, subject to, again, if Mr. Garrett says we can't do it, fine. I mean, we understand. We're just, I'm looking at options.
That is now added to the agenda. Mr. Lewis.
Judge,
Yes,
two
sir.
questions. One is the reason, I guess, for this plan because it's better than the plans that Maryville or Alcoa offer? Or, I mean, have you talked to Maryville or Alcoa?
I have not. I came here first. I have not talked to either one of them.
Okay.
No,
And then,
I just came here first.
then I guess the other issue is, from the county's perspective, is that there would be some obligation on the part of the cities of Alcoa or Maryville to bear part of that cost as well as.
Well, what we're proposing is based from the funds that all three of you entities give us in our budget, plus what we get from the monies from the phones, that we'll just pay it out of our budget. That whatever that $425 for individual and $975 for family and whatever's in between. We would take that from our budget and pay our share, just like we were in office over here.
Yeah, okay. I understand. And then my other question is, what is that cost per employee at Alcoa and at Maryville, so we could compare that?
I don't have any idea. Okay.
Thank you.
Okay, ladies and gentlemen, in line with this, I will stand for a motion to forward this to the full commission pending approval and or response of the county attorney. Is that okay with you, Mayor, since that's your attorney? Yeah. So I will stand for a motion to do that. Mr. French, have a second. Ms. Crisp? Do you understand
Yes,
that?
yes,
okay. You
yes,
good with that?
I'm good with that. Yes, sir.
Okay. Any other discussion? All those in favor signify by saying aye. Aye. Opposed, say nay.
We appreciate the opportunity, and we hope it works out. And if it doesn't,
And
we're good.
Judge, obviously,
We'll figure something
when
out.
we receive response from the county attorney,
Sure.
I'm sure you will hear also.
Yeah, he'll be.
And
I'll be
that will
calling
be
him on the way
forwarded
home.
to the full commission.
Judge, I just want to,
Yes,
I had
sir.
a question.
Yes, sir.
Now, y'all do have insurance now,
We have insurance now.
and but you haven't talked to Maryville Alcoa about whether they're on providing their insurance, right?
No.
Would this be the first time we actually charge a surcharge on this? Make them pay? I'm just kidding.
Thank you, Mayor.
Hey, Judge,
Yes, sir.
if you happen to look down from your bench and see a comedian, it wasn't me.
Gotcha. I understand. We just appreciate the opportunity. Like I said, we're just trying to help the folks that help the county. Okay. Thank you.
Ladies and gentlemen, as previously stated, when we receive the information, Mr. Mann notifies Don and everyone. Jody will do her normal good job and set up a meeting and contact everyone. Is that good with all concerned? I'll stand for motion to adjourn. Oh, time out.
Yeah, just a second, Mr. Chairman. I'd just like to mention
You
one
won't talk
thing.
again.
CTAS is doing a training session this coming Thursday at 8:30 in the UT Knoxville building over there off Henley that is concerned with Affordable Health Care Act and so forth. If anyone here is interested, I'm sure that would be maybe some information as we go forward that'll help us deal with this issue. And secondly, from a personal standpoint, I would like to say thank you to each member of this committee for I know the hard work that's gone into this. It's a hard subject to deal with, and from the comments and everything that I've heard today, everybody has taken this at the most serious level in offering their comments and questions. So that's my two things.
Thank you, sir. Ms. Chris?
To add on to what he said, there will be a live broadcast on that that he was talking about, and it will be lost it here. The web broadcast will be 8:30 a.m. to 12:30.
Thursday,
Yes.
May 2.
Just go to the CTAS
Thank you very
website.
much, ladies and gentlemen. You're very informative. Anyone else? Now we'll stand for a motion to adjourn.